Hello everybody, welcome back to my channel. Today I want to do something a little different. We're gonna talk about case management scenario. So this case management scenario series will be, probably I will do a couple sections. So first of all, I want to give you guys a clear picture of how the case management scenario is. So basically I will provide a scenario or the scenario that happened during my course of a career. So let's begin with the scenario that I'm gonna talk about to you guys today. So let's say a client, a younger individual client who presenting to your clinic or who goes to your office, and the client presents some kind of suicidal ideation. So we're gonna put abbreviation as SI. Client's parent is there, but what happened if a client, when he arrived to the clinic, even though he present to have a suicidal ideation, according to what the parent was talking to you about this, and then what will be the next procedure for you to do. So I'm just gonna give you kind of a quick run of what, as a case manager, what the case manager will do. So when a client present to your clinic or client presented to your office, if the parent tell you a client has suicidal ideation, even the client denies it, the first scenario, the step will be giving a suicidal ideation assessment. So there will be a suicidal assessment for client to review, and then as a case manager or clinical case manager, your job is to review and asking those questions and make sure the client itself can understand all the questions clearly during your interview, and then you also need to collect the data. So by the end of the interview, there will be a number of series to determine if a client has some type of self-harming experiences or self-harming behavior. But it's always according to what the client is talking to you about. So let's continue with a scenario. So once the client finish the suicidal ideation, and then you check the score. Okay, you look at the score and you find out, okay, client is doing okay. You know, there's no need for further assessment. Then you can send the client back to their places, but you still have to continue to monitor the client's behavior by communicating with the parent or their relative. So the second scenario, if a client, according to the score after the evaluation, you do feel like client may need to get additional care, definitely you will contact 911, or you will talk to, if there's a psychiatrist available, if there is a psychiatric nurse is presenting at the scene, that will be better, because at that time you have to use your judgment to see if a client needs additional support. So okay, so let's just put this aside. So when the client get home, let's say the other scenario, the parent call you the next morning and tell you, oh my God, my son or my daughter want to commit suicide. And you hear the information, the parent sending a client either to the psychiatric emergency or to the emergency hospital. So at that time, you kind of have to monitor client's behavior in their situation, right? Because client actually committing suicide. They presenting suicidal ideation. So that will be the time you have to kind of document client's behavior and make sure client is at the baseline, and to kind of check if the client is still at the baseline or not. Because of course, inside the hospital, the responsibility shift to the hospital staff. The psychiatric staff inside the hospital will be able to determine if a client will be able to be discharged. But your job as a case manager still need to go into the hospital to check with the client, and then to see if a client is at their baseline, because those are kind of important things that you need to follow through. So let's just say client get discharged after a couple weeks and they went back home, but you still have to follow with the parent, right? So the parent call you back again after 1 or 2 weeks saying, oh my God, my son or again presenting some kind of suicidal ideation and want to kill himself and have some kind of self-harm behavior. So what do you think what you need to do at this scenario? So I give you a couple solutions here, okay? So first of all, you probably need to talk to the parent to see what they want to do next. If the parent is not able to manage their son or daughter anymore, then they may concern with inpatient program. So the inpatient program is a inpatient program that the client will be monitored by the training staff inside the hospital. So those inpatient program actually they are taking a patient or a client who actually go inside the intensive patient care. So this is the first scenario. The only time that I may give that suggestion is when the client actually really has a lot of suicidal ideation and a lot of difficulty communicating with you. So in during this time, they may need to send you to the inpatient. But this is something that you feel the client really have a serious thought of killing themselves or have a very strong SI, suicidal ideation. Otherwise, I would suggest client go to the outpatient program, which means that they still have a staff monitoring those clients, but they are less severe. Their mental health symptoms tend to be a little bit less severe, so they can go to the outpatient program and again constantly monitored by the staff, the psychiatric staff over there. And once they get better, they can be sending back or refer to the other agency if a parent is not able to contain this teenager or the people, their family. And then the other scenario I would suggest will be give a client a conservatorship. That will kind of help the client to get better sense, may get better. So the conservatorship stay for the client may need a lot of support in terms of their physical, mental health, finance difficulty. So this conservator will be a point of a contact to kind of tell you what happened to the client and if the client will be able to continue to manage their life. But by assigning a conservator, also meaning that client will lose their ability to kind of manage some of their daily life routine. So by assigning conservator, before you need to take a closest evaluation and check on the client's baseline and also check with the parent or their immediate family to feel if the client does need a conservatorship. So if the client agree and if the family member agree, and once the client send a consent, and then their right will be sending to the conservator. The conservator will be able to take all their ownership from the client, but still give client some right. But basically, this conservator will be kind of manage clients' daily life, including their housing, finance, their medication, and then all other stuff. And other thing we forgot to mention is about their medication part. So if a client sometimes is not met compliances, let's say client doesn't want to take Abilify. For this example, the client doesn't want to take Abilify due to a variety of reasons. Client may say they feel nervous, they feel anxious, they cannot go to sleep. So when the client become non-med compliances, and this is something that you need to address with their doctor, their nurses, the psychiatrist, social worker, or their family immediately, because in that way, client will be better to put into the conservatorship or any type of outpatient program in order to make a client improve their daily function. So that's it, and I hope today's video and a case scenario will be good for you. If you do like my channel, feel free to subscribe, feel free to click the like or dislike button, feel free to leave any type of message if you have any question. Thank you so much, and I will see you again.